Welcome to another short from the Vet Med Digest. Today we are looking inside the ear to discuss otitis media, an inflammatory disease of the middle ear cavity that is common but often unrecognized in dogs and cats. In dogs, otitis media is usually a secondary problem occurring in up to 80% of chronic outer ear infection cases. The dog's L-shaped ear canal can trap exudates and destructive enzymes against the eardrum, leading to its rupture and allowing infection to enter and get trapped in the middle ear. An intact eardrum does not rule out disease, as it may have ruptured and healed, trapping infection inside. In cats, the disease often presents differently. It is more commonly a primary issue, resulting from respiratory infections that ascend through the auditory tube into the middle ear. Cats, especially young ones, can also develop oral inflammatory polyps, which are non-cancerous growths that originate from the middle ear lining and cause secondary inflammation and infection. Clinical signs range from head shaking and painful ears to more severe neurological problems if nearby nerves are affected. These can include Horner's syndrome, facial nerve paralysis, or vestibular signs like a head tilt and ataxia if the infection spreads to the inner ear. In severe cases, the infection can extend into the brain, causing life-threatening meningitis or abscesses. Brachycephalic breeds appear particularly predisposed to these intracranial complications. Diagnosis requires a thorough examination, often under anesthesia, using tools like video otoscopy to visualize the eardrum and middle ear. Advanced imaging, such as computed tomography or magnetic resonance imaging, is invaluable for assessing the extent of the disease and identifying any intracranial extension. Treatment must be aggressive, often involving deep flushing of the middle ear cavity, along with targeted topical and systemic antibiotics and anti-inflammatories. For issues like polyps or end-stage disease, surgery, such as a bulla osteotomy, may be necessary, but this carries a significant risk of complications, including persistent Horner syndrome. Thank you for listening. The link for the full podcast is below. Remember to like, share, and subscribe if you enjoy this kind of material. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging.